the Norma Frontalis. What is Norma Frontalis? Norma Frontalis is the frontal view of the skull. So what are the structures seen? From above downwards, we see the forehead, then we see a pair of orbits, the anterior nasal aperture, the malar prominence, the upper jaw and the lower jaw. Let's try to learn about few details of these structures. The forehead is formed by the squamous part of the frontal bone, and in the center it has a region called as glabella, which corresponds to the area between the two eyebrows. The literal meaning of glabella is smooth or hairless. Now this part of the skin of the face does not contain eyebrows, so that is why we refer this to as glabella. Coming from the glabella, we can see these elevations. These elevations are called as superciliary arches, and they usually correspond to the position of eyebrows. Then the point where the nasal bones meet the frontal bone, the squamous part, this region is called as the nasion. Then we have a pair of orbits which lodges the eyeball. The next important structure we have here is the anterior nasal aperture. The anterior nasal aperture is a pyriform opening which is closed in the living by cartilages forming the outline of the nasal cavity. Then we have the malar prominence, which is formed by the zygomatic bone. Then coming to the upper jaw. The upper jaw is formed by the maxilla. The maxilla will have different processes like frontal, then the alveolar and zygomatic. But the most important feature we need to identify here is this opening. This is called as the infraorbital foramen, and this allows for the passage of the infraorbital vessels and nerves. If we draw a straight line above, it cuts through one more opening, or usually represented by a notch as seen here. This is the supraorbital notch, which is usually converted into a foramen called as supraorbital foramen. Infraorbital foramen allows for the passage of infraorbital vessels and nerves. The supraorbital foramen will allow for the passage of the supraorbital vessels and nerves. Then the lower jaw. The lower jaw is formed by the mandible. We can see the body of the mandible, and slightly laterally we can see the ramus. We can see its upper border, we can see the lower border. In line with the infraorbital foramen, we can also identify the mental foramen.